started.
All right, thank you. Okay, thank you for joining us today. We of course know who's joining us, so please introduce yourself in the chat. Today we will be discussing patient engagement and how to use data to improve care. Please feel free to chat in comments and questions during the presentation, and questions will be answered at the end of the webinar.
You entered the call today unmuted. You can use the controls at the bottom of the WebEx to mute and unmute your line. We welcome chat and questions, as Tammy mentioned. During the presentation, please use the chat box to type in your questions and comments throughout the session today.
All right, thank you, Gary. Now a little bit about the series. This was a total of 5 sessions, and this is the last one. We covered 1 to 2 foundational elements of practice transformation in each of our sessions. These sessions were designed to take into account the challenges encountered by small practices. Most importantly, this series was designed for you to take small steps to dip your toes into practice transformation. This is a summary of the steps in practice transformation. These steps are not in any particular order. They're really done simultaneously. However, identifying your patients is really the first step and was covered in our second webinar. Now, don't let this list scare you. It's important to note that your practice could implement only a few of these and still effect change. It's not all or none, but the more invested you are in the change, the more impactful your outcomes will be. Today, we will cover engaging patients in their own care and using data to drive your improvement activities. Previous webinar recordings are available on our website. As we advance in this webinar series, we are working towards the quadruple aim, particularly better outcomes at a lower cost. Just a reminder that lower cost does not mean less care. It just means care in the right setting and at the right time. And if we improve outcomes, then long-term expenses should decrease. So let's start with some definitions. In order to obtain patient engagement, patients must first have the tools to manage those conditions, which can be achieved with self-management support. Self-management support is the help we provide to patients with chronic conditions that enables them to manage their health on a day-to-day basis. Patient engagement is the actions taken by the patient to manage their own health and to benefit from health care. If you have engaged patients, they learn to manage their own health, which leads to better control of their chronic conditions. This can lead to improvement in their hemoglobin A1C and blood pressure, for example, which can impact your practice's quality reporting. Research shows patient involvement in healthcare decision-making and self-management drives improved post-transition outcomes, reduced risk for rehospitalization, and enhanced ability to self-manage. Today, we will discuss more about how to engage patients in their own healthcare. A patient's engagement in their healthcare really cannot happen without patient knowledge and desire. Additionally, they will need varying levels of self-management support. Granted, there may be a few patients out there who don't need that self-management support, but the majority of your patients will benefit from it and need it to keep on track to better manage their health. As you think about how to engage patients in their health care, their health literacy must be taken into account. Health literacy is their ability to obtain, process, and understand basic health information in order to make appropriate decisions. You will communicate differently with patients with low health literacy than with those with high health literacy. For more information on how to communicate with patients with low health literacy, please reference the resource on this slide. Before we can begin to engage patients in maintaining and hopefully improving their health, we should assess what they really know about their health condition. Patients may not understand the impact diabetes has on certain aspects of their lives or how losing some weight can impact their blood pressure. So we should assess what they know. We should never assume someone understands their health condition. Many patients with long-standing diabetes may have never really received education about their disease. As we know, many patients just do what the doctor tells me, with no understanding of why they're doing something. Our goal is to give patients the tools they need to manage their conditions better. Knowledge assessment is best done with open open-ended questions. How many patients have you asked, do you understand how to take your meds? That have said, of course I do, but then you find out later that they really had no clue. So by asking them to tell you about their disease, you can get a better idea of their level of understanding. These questions will vary based on the patient's chronic conditions you're targeting, but some examples are on this slide. On the next slide, we will discuss how to assess patient readiness to change. However, a patient must be educated on their condition before they can really make a decision to change. So it is important that your clinic provides your patient with the needed education. And education differs from self-management support in that self-management support provides tools and more intense education and interaction. Now, a patient's not going to come up to you and say, I'm ready to get my blood sugar under control. This is not a single conversation. This is part of a relationship you build with a patient. These patients may already be engaged in care management and the care manager's having these conversations, or this may come up over a series of provider visits. So don't expect that you'll assess knowledge, provide education to close gaps, and have a patient willing to make a change all at once. Like practice transformation, this really is a process. Now, a really neat tool I like to use to assess a patient's willingness to make a change is the readiness ruler. This tool can be used with anything from the desire to lose weight, to quitting smoking, to controlling blood pressure or blood glucose. This tool assesses how important it is to make the change for the patient and then their confidence in making that change. This tool is used extensively in motivational interviewing, which is a whole other topic that we don't have time to delve into today. What is really great about this tool is the ability to reassess the patient's confidence at intervals. We all know that the desire to make a change does not always lead to immediate success. So as you work with the patient to help them make changes, you should reassess the importance to them to make that change and their confidence to determine if maybe they need some additional moral support, maybe even if it's just short term. So this leads us into our next step of implementation, which is actual self-management support. An engaged patient has the tools to manage their health condition. So instead of doing just what the doctor tells me, they become a part of their healthcare team, as they should be. We want them to be confident in managing their health conditions. There are so many great tools out there to help patients manage their chronic condition. These tools come in many forms, from paper forms to electronic to interactive. As part of your conversations with your patient, you should determine how they best learn and then tailor the tools to their learning style. Considering what motivates your patient and their style of learning will help you decide what resources to provide to that patient. You can go to almost any disease's national organization page and find a ton of resources. Many people are still very visual, and paper and pen are their favorite ways to stay motivated. Many people find journaling to be helpful in identifying triggers. Some may want to develop an action plan that they can hang on their fridge so it's in their face every day. Many like the visual of a thermometer or a countdown to their goal. And you can also consider some other visual cues such as a plate for diet changes or a stoplight for COPD and asthma and CHF. And of course, there's always logs for blood pressure, weight, glucose, food diaries, and all of those. Now, technology has brought a host of tools to use. For instance, fitness trackers have helped many people achieve their weight loss and activity goals, me included. And there are a ton of apps out there that let people digitally log their weight, their blood pressure, etc. And what about all the connected devices, such as blood glucose monitors and scales that send data directly to health apps? I love my Apple Watch because it reminds me to get up and move every hour. Otherwise, I would sit at my desk all day and never move. And there are other patients that need interactive support. In the past, this could have been in-person support groups, but in this time, virtual support groups have really become popular. There are also a number of apps that have virtual coaching, and we can't forget social media. Many patients can be motivated by challenges on social media platforms or groups dedicated specifically to their interest. So when I talk about paper tools, I just wanted to show you some examples. The plate you see on the left is available from the American Diabetes Association, and it gives a patient a visual representation of what they should be eating every day. The stoplight tool is one of those tools that can be used for chronic conditions such as CHF and COPD. And the weight loss goal is a nice visual for those that just need to see their progress over time. Your practice could also consider creating or accessing toolkits to support patients with particular chronic conditions. So this is a set of tools and resources that you can share with your patients as you're working with them and managing their health. I've just chosen 3 common diagnoses here and linked you to some resources you could include in your toolkit. These are all self-management tools and not just strictly educational tools. However, the websites are also great for educational resources as well. Now that you know what kind of tools are out there, you should develop a plan for providing self-management support to your patients. Now, you cannot provide self-management support to all patients. You just don't have the resources for that. So like with every step so far in practice transformation, assessing and prioritizing are really your first steps. You want to start small and then expand. So there are likely some education and tools that you can provide to all patients, but really working closely with certain patients is much, much more time intensive. So first, assess what chronic condition is most prevalent in your practice. This is very likely diabetes or hypertension. You can get this information by running an EMR patient report by diagnoses. If you're unsure of what report to run or how to otherwise get this data, our practice transformation team can certainly assist you. Now that you have a diagnosis targeted for self-management support, check out what resources are available. For diabetes, you should consider what kind of a diabetic education is already being provided in your community that you could refer your patients to. If you find paper tools, consider making them readily available on your website or via your patient portal. Now that you have the tools in your tool belt, you need to decide what patients to reach out to first. These could be patients that are already engaged in care management. Maybe they're patients that the provider's really been struggling with to lower their hemoglobin A1C and they're just looking for new tactics. Or it could be patients that are just super motivated to change. You want to start small with a small number of patients. And then once you get your feet wet, you can examine what's working and what isn't, and then expand as you're able. As always, we must measure our progress to assess if we are actually making an improvement. The most obvious and likely easiest way to assess your progress is to evaluate the patients you've targeted for self-management support. For instance, if you're working with a patient with diabetes, has their hemoglobin A1C improved? Or if their goal was to lose weight, have they actually lost that weight? If you're targeting a specific population with tools and resources, assess the quality measure associated with that diagnosis. For instance, has your hemoglobin A1C quality measure improved? Or for hypertension, has your controlling high blood pressure quality measure improved? If you're regularly surveying your patients, which I'm sure many of you are, what are your survey results showing you? You would expect to see an improvement of the domain, how well providers communicate with patients, as you work to further educate and engage patients. And as always, seek out immediate patient feedback. If you've provided a toolkit to a patient or even just one resource, follow up with them to assess how helpful it was. This will help you to determine what resources to rely upon and which are not as valuable. So along each step of this practice transformation journey, we've mentioned using data to prioritize where to begin and assess your progress. Now we're going to take a deeper dive into how to use data in your practice. So we all know what data is, right? Data is a compilation of facts and statistics that can be used for reference and analysis. But data is really just a bunch of numbers and facts until we actually do something with it. So when we discuss data, it's important that you have the data you need to identify areas for improvement and then also the right data to assess your progress. So you have data coming at you from multiple different sources. For instance, you may get some kind of reports from each of your payers. You could get maybe reports of what care gaps need to be closed by the end of the year, such as needed vaccinations, lab work, or screenings. You may also get reports letting you know what patients are utilizing health care more than is expected. And you're probably also getting claims data. You're going to be getting some level of claims data. And you might also get a list of patients with a certain diagnosis from the payers. So as we talk about how to use data, thinking about what kind of payer reports would be useful to you to have, and then if you don't get that report from a payer, reach out to them and ask for it. If you're part of a larger organization, you may also get quality reports as well as financial reports from your parent organization. If you're affiliated with a hospital, you might also be getting utilization reports for your patients. And wow, is there a ton of data at your fingertips in your EMR. You have an amazing amount of data in your EMR that can be harnessed for practice improvement if you can retrieve it in a meaningful way. So one thing you'll notice as you look at these lists is that each source has different data. By combining some of this data, it becomes even more powerful. So in the next slide, we'll discuss how you can use data from different sources to give you a better picture than just one source alone. So none of your data really should exist in a silo. So here are some examples of how you can combine data sets to better represent the actual work being done in your practice. So for instance, you may get a report from a payer with a list of patients who need a hemoglobin A1C level drawn. However, you know that your office offers point-of-care testing for hemoglobin A1C in your clinic for some patients. So you can run a list from your EMR of patients that you did that point-of-care testing on in the time frame that a payer is looking for, and cross-reference that to see if any of the patients are on that payer list as needing that test. Since the payer gets their data from claims, they may not have that point-of-care data. So by providing that to the payer can update the progress of your practice towards that quality measure, and it really does reflect the work your practice is doing much better. Now, if you get gap reports from multiple payers, consider consolidating them into one report that someone in your clinic can work off of to close those gaps. This could save a lot of time versus looking at multiple reports. Now, this is only a couple of examples of how to combine the data. Our team is happy to help you to combine these multiple data sources in a workable format for your staff. So when I think about how much data is in your EMR, it completely overwhelms me, and I'm sure it overwhelms you as well. But this data can be used to create reports, which is where its power is. So there are many canned reports available in every EMR. Many of them I'm sure you've never ran. Additionally, you likely have the opportunity to create specific reports based on your needs. So you can run reports that run the gamut from financial aging to provider productivity to quality reports. And the reports you will access depends on what you want to know. You should never assume that a report is not available or possible. If the data is there, it can be extracted. Granted, maybe not with the canned reports, but it can be pulled out. Again, our practice transformation team can work with you to harvest data and create a report for you, even if your EMR doesn't have that report capability. So this is a partial list of reports that are likely already built into your EMR that you can use to improve quality in your clinic. As we've been going through this series, we've talked about how to use your personnel resources more effectively. So your EMR should have productivity reports. It's a good idea to run them on a regular basis to assess where you are today and if your data has changed over time. For instance, do you know how long it takes from the time a patient checks in to when they're actually seen by the provider? This report can give you insight on how efficient your rooming process is. And you can further break it down into a provider or care team level to assess if you have an outlier. Maybe you have a provider with great check-in to provider time. So what can the rest of your staff learn from that provider and his team? Now, when we talked about access earlier in this series, we mentioned the IHI next third available appointment. You should also check this on a regular basis to ensure that you have the capacity to see patients in a timely manner and they don't end up seeking care in the ED unnecessarily. And the whole purpose of an EMR is to collect and store your patient data. You can pull, again, all of this data back out. So as you look at process improvement, how do you know what you need to improve? These reports can help you determine where you might have issues that you're unaware of. For instance, is your policy to provide an after-visit summary to patients that includes certain educational components? I know many quality programs have this as one of their requirements. Since that education comes either from your EMR or an interface with your EMR, you should be able to run a report with a list of patients that received education and those who didn't. Maybe you're working to provide more self-management support to your patients with diabetes, and you want to make sure that all of them receive some targeted education with their after-visit summary. So you could run a report to audit your progress in this. And then think about missing lab results. How many patients have labs ordered in the last 6 months but have never received them? This directly impacts patient care. So there are a couple of ways to use this information. First, of course, you could reach out to each patient and remind them to get their lab work done. But what if there's a bigger issue with the workflows? If you were to look at the data, could you determine any trends regarding maybe the lab you're using, the tests that were ordered, the provider, insurance, etc.? The really great thing about having a bunch of data is that you can slice and dice it to look at it from different perspectives. And as we're talking about patient care, you can run reports to identify patients that haven't been seen in a certain time frame so you can reach out to them. Your patient portal or EMR may even have a way to message these patients automatically so you don't have to actually individually call them. This is a great feature in many portals that practices often aren't aware exists, as it takes a little work on the back end to get it all set up. However, that back end time is going to save you a ton of front end time. And as you look at all of these data sources and what you can do with them, be sure to be thinking about how you can rerun the reports after a certain period of time to monitor progress. It's great to run a report once a month to see who's missing lab results, but think about what you could do with that data beyond just a follow-up phone call. Think about how you could use that data to improve compliance with obtaining lab tests. For instance, could you schedule the lab work for a patient to help with compliance, or maybe escort them to the on-premises lab after their appointment? Of course, we cannot forget about the quality reports you have in your EMR. Many practices may only run those at the end of the year for reporting purposes. However, reporting quality measures just for the sake of reporting quality measures doesn't improve quality. You should consider how you can use those reports to improve the quality of care you give your patients throughout the year. The first step is really to monitor that frequently. Monthly would be great, but realistically, quarterly at a minimum. The more you monitor the data, the more likely you are to see when a process has broken down or something in your EMR has changed to impact the data collection. Which leads to our next point, validate the data. Every time your EMR gets an update, you should run your quality reports to ensure that the data is still accurate and the back-end mapping has not changed. Quality reports pull in data from very specific fields. Some of those fields are established by the EMR vendor, but some could be mapped based on your own workflows. And I know from experience that the mapping can be broken during an EMR update. If you don't go back in and validate that data within a few days of an update, you might find out months later that your staff has been doing great work documenting, but the data is not flowing correctly. So this is going to take a massive amount of staff time to correct, and your data may not be as accurate as it should be. And if you run these reports monthly or quarterly, you can also see when performance might be slipping. This is an opportunity for you to examine your workflows to determine what's going on to affect your performance. You can then make changes to improve and monitor your progress. A very important step in the quality data that many practices omit is sharing the data with their staff. Your staff is clicking away in the EMR to ensure that quality measures are captured. But do they ever see the reason why they do that? If you share the data, they see why their work is important and can offer insight as to why the process might not be working. Additionally, you should relate each of your quality measures back to that end result, which is improving the health of your patients. It's not about clicking that the patient had a mammogram or a colonoscopy and when they had it, but it's really about the fact that they actually had the screening and it helped to detect a possible cancer. This connects the dots and ties the work into the outcomes, which is better patient care. And the last report I want to cover with the EMR data is the Patient Care Gaps report. Your EMR may or may not have this capability. They're often called registry reports. These reports list out patients often by diagnosis. For instance, you can run a report of all of your patients with a diagnosis of diabetes who haven't had a hemoglobin A1C in the last 6 months, or all patients over 50 who haven't had colorectal cancer screening in the last 5 years. If your EMR doesn't have the ability to run these reports, often third-party vendors can take your data and run the reports for you. I encourage you to examine what kind of registry reports your EMR has and how you can use them to determine what patients need outreach. Again, our team can assist you in creating these reports. So what do you do with all this data? We've talked a lot about the data and how to look at it. So this slide kind of just summarizes what we've already discussed. So the first step is really to examine what data you already have and determine what is most relevant to your practice. This could be data related to productivity, payment, quality, patient care, etc. And it's absolutely okay not to use every data set you're given. Some just frankly may not be relevant to your practice. Now that you've determined the data that is relevant to your practice, is there a way to combine or aggregate that data to make it more meaningful? Can you combine reports to streamline workflows? Can you cross-reference data between sets to better identify patients for outreach? And looking at quality data in particular, you should assess what quality measures are important to your practice. There are dozens of quality measures to choose from for different payers and payment programs. So determine what measures make the most sense for your practice and really try to focus on the same measures for multiple payers if possible. Once you've determined what quality measures are important to your practice, you should know what reports are available in your EMR to help you achieve your quality goal. And this may go beyond just those actual quality reports that you run regularly. There may be other reports in there that can help you assess where you're going in your quality as you're moving forward and improving quality. Now, if there's data you want to collect but the report's not already available, reach out to your vendor and see if it's possible to create it. If it isn't, it's likely possible to extract the data and then create the report outside of your EMR. If you cannot create the report you want, again, reach out to us and we'll see if we can't assist you. So in this session, we've covered a couple of very, very broad topics. We don't expect you, and you shouldn't expect to implement everything we talked about today. Practice transformation and overall change really happens a little at a time. So think about implementing small tests of change. So next steps for today is to use your EMR data to help you select a chronic condition to target for self-management support, and then implement some small changes to begin to provide that support. Then take some time to explore your EMR for available reports. My guess is that you've never had time to just snoop around for those reports. However, I encourage you to take that time. You may find that something that's taking you hours to do right now could be built into a report or may already be built in and then could save you tons of time in the future. I also encourage you to watch the previous webinar recordings. In them, we offer you small tests of change you can implement in your practice for every step of practice transformation. Our goal at KFMC is to improve health for the entire population. We would love to work individually with your practice in any of the steps we have outlined in the last few weeks. Now we'll address any questions that have been put in chat and also open it up for anyone who has questions.
Sarah, feel free to come off mute and ask your question if you have any.
I was just going to say this webinar, I had all sorts of comments, but then I realized you were recording and maybe I shouldn't.
No, go ahead.
Comments in there.
No, please do.
Just responding, I have to tell you that it's such a relief being the new guy and nobody else in the org knows what this is, that I'm on the right path.
Good to hear.
I'm responsible for Stormont Vale's, all of their ambulatory clinics. Mm-hmm. So we got every flavor out there you can imagine, from little to big to folks that are just using our EMR, but they're not really connected to us, those kind of things.
Yes.
And so I appreciate, I'm going to go back and watch the others, but I appreciate the way that you summed it up because that totally applies, and it's nice to know that I'm kind of going the right way.
Well, that's great. And, you know, and let me go to our next slide, actually. This really talks about what KFMC can provide to you. So we really look at, when we talk about practice transformation, we're looking at this on a practice level. How, you know, we tailor support to every practice. So if you're a practice with 20 providers, you have much different needs than a practice with 2 providers. And our goal is really to look at what each practice has as far as resources and tailor our support for that. So as you're looking at your clinics, you know, if you really want to implement longitudinal care management in your clinics, we can work with you on that and help you to start that process. Those are the kind of things we love to do. So hopefully the other videos will kind of give you that information on kind of those first steps you can take. And if you're contracted with any of the Medicaid MCOs, which I'm sure you are, then these services are free through our contract with Medicaid. So these are free services that we can provide to your organization.
Awesome.
Yeah, well, I'm glad that this was helpful for you.
It very much is. And, you know, even though we are not a small practice, like traditionally, I think who you're talking to is maybe people who aren't connected to their big, like Epic EMR, because fortunately our EMR does do education and it does check a lot of the points, but there's a lot of work that's needed for this that's not just available in some electronic book somewhere. You know?
Yeah, so. We also, you know, we can look at workflows and things like that. So how things are going in the clinic, how the workflow is to make it more efficient to be able to document in that EMR so you can pull it back out and things like that. So yeah, definitely watch those other videos and keep in touch with us and let us know how we can help you. And we're based in Topeka, so we can actually, once it's safe, we can do in-person consults as well.
That'd be wonderful.
Yeah.
Well, I appreciate your time today, guys.
Certainly. So this is our website, and Gary is going to be posting a link to the website, and then also Sarah, he's going to be posting an evaluation. We'd love for you to complete the evaluation. To let us know how we did and what we can do better next time. We definitely look at all the feedback and implement it in our future webinars. And this webinar will be recorded probably by end of day tomorrow, and I will also email you the slides.
Okay.
So
that sounds fantastic. I can do that.
All right. Perfect. Gary, did you put that in chat? I'm not seeing any chat right now.
Yep, they're all in there.
Okay, perfect. My chat box is just lost. There it is. All right. Well, thank you so much for attending today, Sarah, and we look forward to hearing from you.
Excellent. You guys have a great week.
You too,
Thank
Sarah.
you.
Thanks.
Bye-bye.
Bye.
Bye-bye.